Hi, welcome to Reset Your Mindset by LifeStance Health. Myself, Dwight Thompson, and my co-host, Nicolette Lienza, will bring you conversations with leading LifeStance Health professionals who will help guide you on your journey to positive mental health and well-being. At LifeStance, we believe in the 3 pillars of mental health: mental flexibility, mindfulness, and resilience. Hi, thank you for joining us. We're joined today by Aimee Thompson, a psychologist in our Blue Ash, Ohio office. Today, Aimee has joined myself and Nikki to discuss the barriers around mental health and the different aspects to that. So, Aimee, thank you for joining us. Would you please tell us a little bit about yourself?
Yeah, sure. So my name is Dr. Aimee Thompson. I am a clinical psychologist that has been practicing in the area of mental health for almost 10 years now, most of which has been here in the state of Ohio. I see a wide variety of patients, adolescents through adults, focusing on a number of general mental health issues.
Great, good, thank you. Aimee, and let me start off by asking you, what do you think keeps people from obtaining mental health support or care?
You know, Nicole, I think there's a lot of different reasons. I mean, I think that I'm feeling as though there's a lot of education and a lot of advances that we've made recently. However, I do believe that, there still is a large stigma that exists around mental health in general that often speaks as a barrier.
Yes, for sure, for sure.
And so, Aimee, so you've been practicing for 10 years, so you certainly got quite a bit of experience. From your work, have you found that there is more of a barrier? We'll talk about kind of the different facets to just the overall barriers to mental health, but have you found that certain age groups or maybe certain generations that you work with have more of a barrier than others?
You know, what's interesting, Dwight, is that what we know about mental health in general is that it does not discriminate, right? It doesn't discriminate against age. It doesn't discriminate against race, political affiliation, right? Socioeconomic status. We know that 1 in 5 United States adults experience a mental health condition each year, right?
Yes,
1 in 6 youth between 6 and 17. And for those statistics that are given to us by organizations like National Institute of Mental Health and National Institutions of Health, we know that 50% of that mental health begins by the age of 14, right?
Yeah.
So, there are lots of people out there that really need mental health support, mental health education. And what we know is that people are not getting treatment, right? So what we talked about before and what we mentioned before is just what are those barriers to treatment, and is stigma one of them, which I believe very strongly yes. A recent study showed that only about 50% of white adults that are needing mental health treatment are actually getting the treatment that they need. And that percentage drops down to 25 to 30% for populations such as Black Americans, Asian Americans, Spanish, and mixed race populations. So even though all of these people are needing this treatment, there really are real barriers to them getting it, regardless of where they're at.
Yeah, thank you for that. I think you hit the nail on the head with it does not discriminate. And I think that's, if you just start to kind of view it from that realm, I think you can kind of have a new appreciation for just like the sense of urgency that there needs to be when it comes to seeking mental health care.
For sure, which is a good jump into of what to do about that. What can clinicians do? What can mental health professionals do to help educate or reduce the stigma so people can get the help?
Yeah. So, I think so much of it starts with us really examining what is that stigma, right? Where does the stigma come from and what's keeping it going? We know there's been a long-standing history of stigma around mental illness. I mean, way back when, right? Before any of us were born, right?
Right.
There were things such as people were thinking that, mental illness was the mark of the devil,
Yes.
or mental illness was a moral punishment for someone that was experiencing a mental health concern. Related to women, it was viewed as hysteria, related to being a woman,
Yes.
right?
Yes.
Yeah.
And we had no education around how to treat these conditions. So we were doing things such as lobotomies, right?
Yeah.
Where we were trying to damage the brain tissue in an attempt to try and get rid of these mental health symptoms. And so I think, when to go back to your question as what can we do, right? It's really acknowledging that this is not a new problem. And yes, we've made advances for sure. But I think that we still have a long way to go.
Absolutely.
Right?
Yeah.
Yeah. Aimee, you bring up a good point. So this is one of the facets we can kind of start with. Tell us a little bit about what you have found when it comes to the way the female population views the importance of their mental health care for oneself, and then on the flip side, how you feel women are frequently viewed just from the general population when it comes to the seriousness, if you will, of the mental health concerns that they present.
It's interesting because I feel like women are often finding themselves in a double bind, right? Because stereotypically we are viewed as the more sensitive and the more emotional gender, right?
Yeah.
And so, people might view, someone who is sad or tearful or stressed or overwhelmed or, anxious as, they're just a dramatic person, right?
Yes.
And not truly appreciate sort of what that is going through. On the flip side of that, women are often seen as caregivers. So in the same light, we're expected to be kind of strong and keep it together to help other people, right? And so for women, what I've seen in my practice is just really the validation of kind of what they're going through, giving them a name and giving them some education around what they're experiencing, right, has been really helpful, Dwight. I mean, and just helping educate them on what treatment can do to support them.
Sure. So, these women, one thing I always like to remind myself is it's important to control what you can control. So these women cannot necessarily control whether it's the way they're viewed by a peer or just the general population. What advice would you give to someone who is looking to feel validated that their concerns are real and that they don't need to hear it from anybody else, but what they're going through is real and it is legit? And what advice would you give to kind of taking initiative to align themselves with care?
One of the things that I also always talk to my patients about is your story is your story.
Yeah, right.
And exactly, Dwight, like what you just said, right? I can't compare that what I'm going through is more difficult or is not as severe as what somebody else is going through, right? And so, yes, to take control of what we can control is to say, this is my body, this is my mind, I know what I'm experiencing, right? And so how can I be empowered to help myself be better, right? So that I can function better.
Yep. Sure. And if I might piggyback on that, is as you're working with your clients to empower themselves and the stories they might tell themselves in general, but also looking at that connections with other people, connecting with others to say, look, I'm struggling. This is my thing. Is this a thing for you too? And the power of that, of feeling like, hey, your story might not be exactly like my story, but you some of this is familiar enough and feels similar enough that it feels like you get me. And the power of that connection with other people and being able to share it, for sure.
Oh, absolutely. I mean, and especially in today's day and age, right? Whether that's person-to-person connection within, friends and family that are, able to kind of communicate and kind of validate with each other, right?
Yes,
or whether that's on a broader spectrum, I mean, for better or worse, this is a way that social media can be helpful, right? There's a number of hashtag campaigns out there. There's a number of different online forums. I mean, you have celebrities that are using their platforms, right? I mean, I think, there are some national athletic associations that are now, hiring psychologists and really making mental health of their athletes a priority, right?
Yes.
You have celebrities such as, Demi Lovato, Lady Gaga, coming
Sure.
out and talking about the struggles that they've been through, right? And there truly is a power in numbers.
Yes,
Absolutely.
for sure. For
Thank
sure.
you. Thank you for that, Aimee. That's really insightful. Okay, so Aimee, you brought up a few different points that I would like to touch on. We can start with social media. You're absolutely right. Social media is obviously frequently viewed in a negative light, but it has so many aspects to it that can certainly be spun positively, and especially in relation to the discussion that we're having right now, breaking down some of the barriers to mental health. I have seen social media campaigns regarding, suicide hotlines, whatever it may be, that people might not have seen if it weren't for social media.
Very
In
true.
your judgment, how can social media be utilized to break down these barriers to mental health, like we've been talking about?
Absolutely. So one of the first things that I do with my patients as we're talking just around stigma and how stigma plays into how they experience both themselves as well as mental health in general is talk about social media, because it is very prevalent, right? And so we talk about how they're using social media, right?
Sure.
And first and foremost, one of the things that we always talk about is, like you spoke about, Dwight, is, there is the negative to social media. And I heard a quote one time that I think was really powerful for me, that oftentimes we want to make sure that we're not comparing our kind of behind the scenes story to somebody.
Sure.
Yeah.
Yep.
For sure.
So, we talk about that, and then we talk about, okay, so how can we use social media in a positive way? So we talk about what are some of the, common hashtag campaigns that are out there on Instagram? What are some of the, I always direct people to the NAMI site, right? Because they have a number of resources on there, whether it's handouts, whether it's getting involved in walks, right? I talk to people about different websites, like different community websites, right, that have education. We talk about how, different blog posts and things are out there. We just really talk about what are the resources and how can we use them in a positive way.
Sure.
For sure. Definitely. Let me, piggyback with looking at social media as a positive platform, which makes me think of often in the media how mental illness is portrayed in movies and things like that. I know a recent movie that's been out is The Joker. And I don't know if you guys have seen it, but it just kind of take you through kind of like how his own mental health deteriorated and then how he became the Joker. But again, it sometimes that can still perpetuate the stigma in our movies and different things like that. And so that's hard, as we're trying to use social media as a positive platform, we also need to get Hollywood and those other platforms to also portray it differently as well, which I see it can be a big problem for sure.
Oh yeah, I absolutely agree with that. And I think, that often segues me into things like talking with clients about, language is important.
Yeah.
Right.
Yeah.
Using the word crazy, right? Talking about someone as being crazy.
Sure.
Talking about a quote unquote schizophrenic versus somebody with schizophrenia, right? I mean, language is really important. And I'm a big believer in the compound effect, right?
Yes.
And so whether it's within our small kind of intimate circles or whether it's on a broader level and the way that we're talking on social media, even on our own pages, right? It's making those small changes, and language is one of them.
Yeah.
So for those that may not be familiar with the compound effect, can you allude to that just a little bit?
Sure. So the compound effect is basically the idea that, it's small things that lead up to big change, right? When we think about making a change, we often think about these, large actions that need to happen in order for that to result. But what we know about the compound effect is that small changes that occur every day are what lead us to the outcomes that we're desiring.
Okay. Thank you. So, Aimee, I think you have done a wonderful job of shedding light on barriers that we kind of are. I think we're looking at it at sort of like a macro level, I guess. But from a micro level, looking at you touched on this earlier, but the disparity that is just amongst different races in the nation that do receive healthcare juxtaposed to maybe the white population. I know that just speaking as a person of color myself, I have grown up, I have experienced the bias that lies within the African American community against seeking mental health care. Similarly to the way women, I think, are often invalidated in some of their feelings. I think amongst the African American community, amongst ourselves, we tend to steer our own peers away from seeking mental health care. It is something that is viewed as even weak at times. I think when you look at different cultures, there's such a strong base of faith and religion, which it can certainly be a good thing. But, you know, as anybody knows, that faith can, it can only get you so far, but there are some other actions that can take place. So have you found, when you are seeing patients of all sorts of different races, are you finding that you are having these kinds of conversations where there might be someone coming into your office that it's the first time, they're the first person in their family that has maybe even sought out mental health care? So.
Absolutely. Absolutely. And, backing up a little bit from that, Dwight, one of the things that I always find important to think about, right, is just the therapist match, right? And everybody has different approaches, different beliefs. I mean, we are humans too, right?
Sure.
So I can speak to my personal approach, right? And absolutely, I am having these conversations, right? Especially when I'm looking at a more marginalized group, whether it is, racially, gender-based, and we're talking about that, right? I can't tell you how many people I've had come in that say, oh, my family just thinks that I'm trying to get attention, right? Especially from an adolescent or a young adult, right? Or, I had an older African-American gentleman come in who said, once we really kind of got into what was going on, and, he said, Aimee, I can't tell you, I've experienced this my whole life, right? But was told just to kind of suck it up. Let's go to church. We're going to pray about it. And we're going to move forward. Right. And so I have a lot of conversations about the intersection of, it doesn't have to be, in that instance, it doesn't have to be religion or treatment.
Sure,
right. How can we? Absolutely not mutually exclusive. And so how can we merge those things together? How can we have conversations with our family who's questioning why we're in treatment?
Sure.
Right.
Yeah. Yeah. That makes sense. I know, I think you touched on the National Alliance for Mental Illness, which is NAMI, and they do a lot of just excellent research into some of the disparities and what races are more likely to seek care. And I was really startled that I saw 30% of African American individuals receive treatment, juxtaposed to the national average of 45%.
Right.
Absolutely.
I mean, that is just, the proof is in the pudding with that. And that's really startling.
Absolutely.
Great.
Absolutely.
And if I might add another little twist here of bringing it back to gender identified males who are socialized maybe not to share feelings, where I'll be working with gentlemen who were told all their life, like, you don't talk about this, you don't cry, and how that then also keeps them from going and seeking out help from a therapist, of that societal expectation that men are tough, men, you just suck it up and keep going, and what injustice we do that, to our males as well. So.
Right. That's a great point, Nikki. That's an excellent point. And I think the big, what I at least have taken away in large part is not only is there some education that needs to be done on an individual basis, but then that individual has to know how to have the conversations with their loved ones.
Yeah.
Because they might receive some pushback.
Absolutely.
Yeah.
And those can be scary conversations.
Sure.
Right. And so using some of the time in treatment to sort of role play those and explore those and what might those look like. Right. Because you're absolutely, Dwight, those can be very scary conversations, especially when you're breaking the mold of what's been there from a generational standpoint.
Sure. Right. Yeah. Very true. Well, Aimee, this has been great. You are definitely a wealth of knowledge. And let me just put out there some of my takeaways of a bit of what we've been talking about. I think number one was just acknowledging that this isn't just a current problem, looking at the barriers to mental health and the stigma, that this has been around for a while, that this isn't a new thing now, but we're going to continue to try to make it better for people to feel comfortable to seek mental health help. Using social media as a positive platforms, as well as our media being aware of how they portray mental illness. And I also agree with you when you said language is so important in the language that we are using to describe mental health issues and things like that. And that ultimately we still do have a long way to go, but at least we're on the path moving forward in the right direction for sure. Quite anything on the air?
Absolutely. No, I think all of those, very much true, right? Again, I think that we've come a long way, right? But the education and the funding needs to continue so that we can continue to break down some of these barriers, right? So looking at our words, looking at what funding is coming in and how we can continue to further the health of mental health. Further the understanding of mental health, but also the importance of treatment and to keep improving our evidence-based treatments. Right?
Yeah.
So that we can continue to help.
Right. I think the premise of mental health is just as important as physical health. I think that's something that needs to get out there more. Right?
Absolutely. And no, I think, Nikki, if nothing else, you look at just so many of the different sporting organizations that, obviously you have athletes that make up the employees of these different organizations. And obviously they put a lot of emphasis on their bodies and their physical health, and you're seeing so much more frequently now that these athletes are putting a huge amount of investment into their mental health, and finally realize that we can be great athletes, we can be physical specimens, but without your mental health, you really are not much of anything at all. So
you got it.
We're ahead of the curve finally, and starting to make a lot of progress. And Aimee, we cannot thank you enough for doing this. You were truly a phenomenal guest, very insightful. I think a lot of listeners are going to have a lot of positive takeaways.
For sure.
Wonderful. Well, thank you for having me. It was an honor.
Thank you, Aimee. All right.
Thank you for listening to another episode of Reset Your Mindset by LifeStance Health. I thought Aimee did an excellent job shedding light on the progress that we have already made as a society and the progress that is still yet to be made around breaking down barriers to mental health. On our next episode, we will be talking to Melanie Falls about toxic relationships and what we can do to navigate them. Thank you for listening.